Health economics and outcomes research is about turning real-world healthcare data into evidence that supports practical decisions. That might be decisions about value, access, or how a treatment performs outside the controlled setting of a clinical trial. The goal is not just to describe what happened, but to produce analyses that are clear enough and reliable enough to inform pricing, reimbursement, and policy discussions. A lot of health economics and outcomes research work starts with a simple question that has complicated data behind it. Teams may want to understand how a drug is used over time, whether patients persist with treatment or switch, or how treatment patterns differ between products. Often, the focus includes healthcare resource use, such as hospitalizations and outpatient visits, and the costs associated with those events. Another common use is checking feasibility, meaning whether there is a sufficient real-world population that matches the inclusion and exclusion criteria for an upcoming trial. To answer questions like these, programming is central. The job is to translate a business question into something the data can actually support, which means defining cohorts, building variables, and creating analysis-ready datasets that can underpin outcomes and economic evaluations. That work depends on a solid grasp of how the underlying databases are structured, how coding rules work, and how the statistical approach will handle real-world complexity. The databases themselves are often huge and messy. Longitudinal sources are designed to follow patients over time, sometimes across different care settings. Common examples include administrative claims data, which record diagnoses, procedures, and pharmacy dispensings, and clinical databases from primary care or hospital networks. These resources can include millions of individuals with records extending over many years, and pulling everything into flat files can quickly become slow, expensive, and difficult to control. A practical way to handle this scale is to use a dedicated data warehouse environment. Raw vendor data are typically pre-processed to harmonise coding, resolve inconsistencies, and integrate multiple sources where needed. Then, as much processing as possible is pushed into the database using platforms like Teradata or similar technologies from other vendors. Analysts work in SQL to define cohorts and derive variables, and only then extract smaller, curated datasets into tools for modelling. This keeps runtimes manageable and makes it easier to rerun analyses when assumptions change. Study design choices matter. A typical workflow begins with clear cohort definition, including inclusion and exclusion criteria, look-back periods, and baseline definitions. Next come the analyses, often starting with descriptive summaries of demographics, comorbidities, treatment patterns, and healthcare utilization and costs. Depending on the decision problem, analyses may also compare treatments, examine persistence and switching, or use case control style comparisons. Modelling commonly includes regression approaches such as logistic regression and time-to-event methods like survival analysis to adjust for confounding. Because there are many moving parts, collaboration and quality control are essential. Teams benefit from early alignment on the decision question and from being realistic about data limitations such as missing variables, incomplete follow-up, or coding changes over time. Detailed cohort specifications and code lists support transparency, and independent programming checks help catch logic errors before results are final. Strong documentation also supports reproducibility, which is increasingly expected by payers and assessment bodies. Ultimately, health economics and outcomes research adds value when the analysis stays anchored to the decision it is meant to support, and when the methods and assumptions are clear enough to stand up to scrutiny. To learn how Quanticate can support your next trial, email inquiries@quanticate.com or request a consultation through our website. Thanks for watching, and don't forget to subscribe for more practical insights on clinical trials and modern drug development.